And our next speaker is Dr. Ramesh Kekunaya. I've got you, babe. Intraocular lens implants in children under the age of 2.
Good. Thank you very much for inviting me. I have got 3 ARS questions, so open your app so that we can answer on time. I'm going to talk about IOL implantation in less than 2 years. I do not have any financial interest or relationship to disclose. You all know that in the first 2 years, the axial length significantly changes, and in the first 6 months, the keratometry changes. And we are doing cataract surgery on this dynamic eye. I just want to ask one question. What is the minimum age? What's the minimum age at which you implant IOL in children under 2 years? 2 to 6 months, 7 months to 1 year, 13 months to 2 years, will not consider. So, hovering between 7 months to 2 years, majority of the people. This is what exactly is happening. Based on age, how do you decide? If you look at the first zone here, till 7 months, it's a gray zone. What exactly needs to be done? Between 7 to 12 months, I would say it's kind of comfortable, but still there are questions unanswered. And beyond 12 months, I think it's mostly comfortable. The next question is, what are the factors you consider while deciding on implanting the IOL in children under 2 years? Age, corneal diameter, absence of additional ocular or systemic abnormalities, intraoperative findings, socioeconomic factors, all of the above. There are 6 points there. So that's clear cut. So age is not the only one. Corneal diameter, other associations. Laterality is important. Intraoperative findings, socioeconomic status, and surgical experience of the surgeon. And what are you offering, what the child or a parent can afford in terms of postoperative care. We are talking about 2 different things here. Unilateral versus bilateral are 2 different things because unilateral, one of the eye is not seeing. For the bilateral, even the brain is not working functionally in this patient. And obviously, when you have a patients like this, all of them have similar looking face and the eyes. You can see the swirl of the hair. This is typical rubella. If you see a child, this is the dysmorphism, what you see in a rubella patient. You don't have to do any investigation. So probably we will not be able to implant the IOL here. And obviously the last thing is what kind of morphology you are looking at and what's the association we are looking at that decides your surgery. This is the last question. What's the most important concern if you implant an IOL under 2 years of age? Visual axis opacification, glaucoma, myopic shift, need of second surgery. Okay, almost similar, I would say. So, if you look at the literature, there are significant number of literature at this point of time for infantile aphakia treatment study says that there are significant adverse events in the first year of life if you implant the lens. If you look at this study, 4-year outcome says the same, except that some of the situations where the cost factor and the socioeconomic status can be considered when you are doing IOL implantation. And this is the recent study, IOL under 2. Again, it says that routine use of intraocular lens is not recommended under 2 years of age. If you look at the intraocular lens implantation papers, this is one of paper from India under 2 years of age. It's an RCT. It says incidence of postoperative complications are similar in both groups, And there was an early visual rehabilitation, which was faster in pseudophakic group. This is one of our publications we looked at under 2 years of age. It says the results suggest that the under 2 years of age lens implantation can be safe and it could be a viable option. We also looked at one more publication from India by Jagatram and group. And again, it says the long-term outcome is quite good and it's safe. And if you see pseudophakic group, this is one more paper from the same group, which says that adverse events are less in primary IOL implantation group. And if you see the TAP study, again, between 7 to 24 months, it says that intraocular lens is safe, but less than 6, probably it's not considered. We looked at patients with less than 6 months. We followed them up for almost 3.5 years. And we found that in terms of visual axis opacification is the most common complication. Myopic shift is observed in most of these patients. So this is the details of this surgery. Even under 2 years of age, we had 31 patients who are less than 6 months. And this is the complication in this paper, and this is the complication what you are seeing in this particular paper. Almost 70% of the people did not have any visual axis opacification. 18% of them had visually significant opacification which needed membranectomy. So this is the myopic shift. If you see in the 3 years, there was a significant myopic shift in this age group. And the visual outcome, as expected, it was much better with the bilateral group versus unilateral group. So if you see an infantile cataract who are less than 6 months, IOL can be reasonably considered in this group, provided that you will see probably 1 in 5 cases having visual axis opacification. Our experience with the infants less than 6 months, we can't implant in every patient because of the 6 factors we said. What we can implant is only in 55 to 60%. It's not that all patients under 6 months we can implant. And when it comes to more than 6 months, we can implant lens in close to 75% of the patients. And if you look at the cost factor, the magnitude of childhood blindness, as you can see in this slide, is maximum in the very poor and poor socioeconomic status. And if you see this report, bilateral, isolated, hereditary, total nuclear morphology congenital cataracts are much more seen in developing world than developed world. And if you look at the cost factor, the IETS says that IOL group had a much more cost compared to the phakia group because there was an increased number of unplanned surgeries in the IOL group. And the total cost management of IOL group dropped dramatically in the first year because all these secondary interventions happened in the first year. And this is a comparison between US and India. Some of the cost factors I put, it's almost similar in all the developing countries in terms of cost. This cost has to be read in terms of GDP of US is almost 7.5 times higher than that of India. And this is an important consideration when you are doing. And majority of this congenital cataract patients are in Asia and Africa. And we looked at the follow-up profile of these patients over 5 years period, and you can see how dramatically it drops after the first or second visit, both in the higher as well as lower socioeconomic status. So intraocular lens implantation in these children, when they come to us, it's not just a flip of coin where I'll implant or not. It depends upon much more factors as I put here: biometry values, ocular comorbidities, surgical experience. I would give a greatest emphasis on that as well, socioeconomic status on the green, and obviously any kind of intraoperative findings and complications we might have to defer IOL. So it's not just one factor which is important. In summary, I would say that IOL implantation should be considered even in selected babies who are less than 6 months. IOL are not to be based on just, it should be a case-to-case decision, not purely based on age. One must acquire adequate skills. I think this one aspect, probably the newer technology can reduce this learning curve for most of the new surgeons. Probably in the future, we need to look into it. And if IOL is not feasible for any reason, FAK is an alternative. Thank you very much.